Hey, this is Tracy with the Tracy's Keeping It Real show. Hi, good afternoon, everyone. It's Tracy, and it's Tracy's Keeping It Real this afternoon. What a wonderful day we're having in the neighborhood, and we have some really cool guests in the studio with us today. So I'm going to jump right in and introduce them, and then they're going to tell you a whole lot about what they're doing and how it's impacting our community, and we're really excited to hear more about them. So we right now in our studio, we're talking about the Minnesota Association for Children's Mental Health, otherwise known as MACMH. And in our studio, we have Brandon Jones, who is the executive director of the program, and we also have Twanna Anderson, the community engagement and special projects director. Please help us to understand more about what your roles are there. And Brandon, let's start with you as the executive director. Tell us more about the program and how this came to be and kind of how it's helping our community to be a better community.
Yeah, absolutely. Thank you. Thank you for having us as well. The program actually the organization started in 1989. I took over for the founder. She retired back in 2021, right at the midpoint of the pandemic. She decided I'm gonna check out and get up out of here. So that's what happened. And myself at the time, I wasn't actually looking for an executive director position, but the board of the organization said, "Hey, your name keeps popping up. You sound like somebody who could really lead this organization to the next level. Would you be interested in doing an interview?" So I took it. I took the interview, and one thing led to another, and it's been a good fit. A lot of people don't know who we are, haven't heard of us. To be honest, I had a little bit more clout than the organization did for in a lot of spaces when it comes to mental health. So my goal has really been to raise the awareness as part of bringing Twanna on, and let people know that we are here to make an impact in the community. Now, what we do, we got to have a three-prong approach. The first approach is we work with professionals. We do a lot of professional development training. For the folks who do know about us, they know that we throw a big conference in Duluth every April. It's the Minnesota Association for Children's Mental Health and Adolescence Conference. We call it MACMH for short. And typically we get between 1,700 to 2,000 people to come up to Duluth and spend some time with us for 2.5 days. Great learning opportunity, great networking opportunity, and really just helping to advance the field of mental health, but especially for children and adolescents. So that's the big thing that we do. We also do trainings throughout the year through our training series, and we throw a second conference that's focused specifically on infant mental health, which is our what we call our IEC conference, which happens every November. So that's our professional development. The other two prongs that we have is we work with parents and caregivers to help them navigate the mental health system. Unfortunately, as we know, especially in our community, once you get into one of these institutions, one of these systems, it often leads to a next. And a lot of times people are lost in the shuffle. What we try to do is provide some relief to that and some assistance by helping parents navigate the mental health systems that they are currently in, as well as the school system that they're currently in as well. And then the third thing that we do is we work directly with youth and helping them develop and amplify their voice and what mental health and emotional health means to them.
Wow,
Yeah.
so a lot of working with our youth, and you mentioned that you had a lot more clout in the beginning than the
Yeah, yeah.
organization because the organization, as you said, is new, and it started in 2021,
Well,
2020.
I started at 20.
You started 2021.
Yeah,
When the
the
organization
organization started at 89. So
started?
we're celebrating our 34th year. We're
Wow.
having our
Okay.
31st birthday. But the organization was kind of like Fight Club. Like if you knew about it, you knew about it. If you didn't, you didn't.
Yeah.
So that was kind of how it operated. And we also were in the shadows of NAMI, who was one of our community partners. That is a major organization. So a lot of us, people who do know about MACMA, they knew about us as kind of like NAMI's little sister.
It is, and is the little sister because of ethnicity? Is it
Oh,
an
that's a good
African
question.
American primarily? Because
Yep.
focused on mental health.
No, so I wouldn't say it was due to culture. In that element, I don't think it was ethnicity or race. I think just the work that was done for the organization wasn't amplified. We didn't really have a digital footprint. We didn't market ourselves the way that we market ourselves today. So it was just a small, tightly run organization. And my goal coming into the executive director role was to get out of that shadow of NAMI and let people know we are our own organization and we do big work. We're small, but we're mighty at the same time.
Right. So you mentioned that one of your bigger projects you do out of Duluth.
Yep.
Why Duluth? I mean, because you're
Yep.
based here in Minneapolis, right?
Mm-hmm. Yep.
So what took you to Duluth to have your biggest thing there?
Great question. Great question. So we've been doing our conference now for 28 years.
28.
28 years. And Duluth was the first location. I don't know if it was a board member that had the connection or if it was the previous executive director, but that became tradition. And one of the things that I didn't want to change for the organization was moving it from that. The city of Duluth has been very welcoming to our organization. We throw our conference at the deck up there, which is their main entertainment complex, and we try to draw as many people as possible to that space. What I will say that is very different, and we got a lot of feedback, especially this year about the conference, is that it's become way more diverse since I've been leading the organization. And that has been intentional because the folks who are doing this work, they're not just the folks who look like the majority population of Minnesota. They're not just white folks. Like there are a lot of folks of color doing this work, and they also need to have a professional home as well. And that's what our organization is about: is to offer that professional home for them too.
Nice, nice, nice. So that must be why you got Twanna here, because with
Absolutely.
her being the community engagement and special projects director, she's involved with the community.
Right.
So talk a little bit about Twanna, what your role is there, and how your work is working in the community.
Well, let me just say thank you again for having us on here. Really appreciate this opportunity and being able to connect with you and the community is an awesome opportunity. So thank you again.
We love having you.
So, community engagement is something that MACMA really didn't do before I came. The foundation really is professional development, clinic work. You can, if you're in this field, you can get all of your continuing education credits just by dealing with us alone through all of our training. So, being able to recognize, I think COVID really did that, recognize that our mental health of our children's mental health goes beyond those diagnosed conditions and that we need to nurture our children every day and teach them how to navigate their emotions. It's okay to feel your emotions. That's really what we want them to do. So I keep saying over and over again that I kind of want us to get off of this just suck it up attitude with our kids. We really need to nurture their mental health because in order for our children to have strong mental health, the adults in their lives have to too. So it's a very good connection. And so for me, this is like the jam of my day, being able to get out in the community and tell people who we are. And I love this organization. When I first started last year, it was right before the conference.
Mm-hmm.
And so I didn't have any assignments, didn't really know what to do. So I just brought my camera because that's what I have experience with. And I got a chance to speak with people who were there just to attend, volunteers, board members, educators. I got a chance to just ask them, what does MACMA mean to you? And just the answers that I got made me fall in love with this organization before I even really got started. So I enjoy the opportunity getting out in the community. We recognize now it's more than just what the clinicians do. We need to be there to support our children.
Absolutely. So how a little bit of the background. You talk about adverse childhood experience,
Yeah.
which you guys use the acronyms of ACE,
Yep.
historical and intergenerational trauma, social emotional intelligence.
Mm-hmm.
You're talking about the intercultural development and inventory.
Yep.
So help us understand each diagnosis that's listed here that I just mentioned,
Mm-hmm.
and give our listeners and our viewers an example on how your facility provides support and
In those
assistance.
areas. Absolutely. So those areas are a lot of the areas that I specialize in the work that I do. So a lot of my philosophy is around, how do we address those things for our kids? For example, ACEs, adverse childhood experiences. It's a very well-known concept in this field in the state of Minnesota. A lot of people have been trained in ACEs. And ACEs ultimately is when children experience adversity very early on in life, from conception to, let's say, 16, 17 years old, it does have impacts on their brain development and on their social outcomes later on.
So let me just stop you here
Yep.
just because I want to make sure that our listeners and viewers are following you.
Yep.
So if my child has adversity, what am I looking for? What does that mean?
Yeah, so adversity can be a lot of different things. It could be domestic violence in the home. It could be you were neglected. It could be that, you were severely beaten. You may have been sex trafficked. You could be bullied. Those are some more severe things. You could have had a parent that was incarcerated. You could have had someone who's addicted in your nuclear family. You could have somebody with a severe mental illness. Autism could be one of those things that made it very challenging for you to grow up. There's a good chance that if you've had several of those things taking place within your household, it does impact the way that your brain develops. Does it mean your brain damaged? No, but it has an impact on your brain development because now your brain is developing around survival with those things in mind. So that's what ACEs is about.
Okay.
Now, ACEs became very popular in the late 1990s. There were two medical doctors, Dr. Anda and Dr. Folletti, who came up with the ACE study, where they studied over 17,000 participants in the combination with the CDC, Center for Disease Control, and Kaiser Permanente, which is an insurance and medical company on the West Coast. And they did this massive study, and they found out that folks who went through a lot of adversity very early on in their lives had complications later on. And it became this thing called the ACE study. Now, they looked at a dominant population, which was white folks, middle class white folks, and that's why it became a study. But in our community, we've known about ACEs all the time. I know for sure my grandma could have been Dr. Valetti, because I remember there was a time where I'd be in a community, there was a guy named Reggie, we just call him Reggie. And I remember asking my grandma, what's wrong with Reggie? And she'd be like, boy, something happened to him when he was younger. That's why he act like that. That's all ACEs is. We know when children go through trauma or have experiences very early, it does have an impact on who they become as adults.
It does. It does. And that's why they talk about the child to prison pipeline. Because it's what happened now you may end up being a statistic later.
Absolutely.
Inmate. So I understand that. So let's talk then about the historical and intergenerational trauma. Is that still more part of what you just said? What about the social emotional intelligence that how does that play into
all connected? Yeah. So a lot of our programming and the things that we do has social emotional learning or intelligence baked into it, because we know that one of the keys to dealing with some of the adversity that happens in our communities is building those skill sets, being able to understand how to do a self-assessment, how to manage your relationships, how to have empathy for one another and yourself. How to have social awareness, being able to see what's around you, how to have some self-control as well. So a lot of the things that we do has that social emotional element within it. Now, what is that combating? It's combating the intergenerational trauma. It's combating the historical trauma that many of our communities are experiencing. Most of the time, we're experiencing these things, we don't even know it, because a lot of our responses to the trauma has become culture over time. But let's look at us, for example, Black folks. African American folks. At one point in time, we called our culture the struggle, because we've been so used to dealing with adversity, so used to dealing with, white supremacy and racism, and also anti-blackness within our own community, that it just became cultural for us, and we would expect that struggle to show up. So when we're working and we're tag teaming with communities, how do we reverse that a little bit? How do we make sure that people aren't expecting that adversity is going to show up and they can live a life of abundance and thrive and move forward, but we do it from a lens of emotional mental health.
Okay.
Yeah.
Okay. Twanna, when he talks about community and you're out there working in the community, what community are you connecting to? Are you connecting to the community of other agencies? Are you connecting to communities that work with children that are dealing with mental health? What community are you connecting with?
Yes and yes. The first thing that I did was to really make an assessment of who we already work with, who our partners are, who we collaborate with, and how we support each other, if we support one another. Sometimes the support simply comes as a tabling opportunity at a conference. But now we're doing a little bit more. Like the first year I got here, we worked with every meal. For September, Hunger Action Awareness Month, because my other job was with food insecurity. So I understand that connection with children's mental health and food, being hungry. Because if we're hangry, imagine what our kids are doing when they don't know where they're going to get their next meal, when they're trying to figure out how they can eat now at school before they get home because they don't know they're not going to eat. So we're doing collaborations like that. And I think that's really amazing. We're working with the Montessori school so we can tell communities a little bit more about culturally specific opportunities for early childhood education. We are having our own events now. We're working with the Youth Council and doing a youth summit in June. So a lot of things that has not been typical of what we do, because we're getting out in the community, we're learning more about how we can really support each other. And you don't know until you get out there and ask. And so that's what I've been doing. What can we do? How can we amplify? Because for me, it's not just asking for the support. It's also, how do we support you? And that's what community is, right? Supporting one another. And so that's really been my goal for this first year that I've been here. I have to make sure that I relax a little bit. When I came in, I was like Speedy Gonzalez. I was really trying to get a lot done. But it's really important, I think, now that we just lay the best foundation for this department as everything else has been laid for this organization. So I'm just trying to make sure that we amplify what we do, really inspire people to learn more about what we do, and then find a way to support us or ask for support.
Okay, nice. So now, Brandon, you said something and it made me think about what our listeners and viewers might want to know. So when it was under Name It,
Yeah.
it was just a program, right? Or what was it under Name It?
Yeah,
Exactly.
so it started, so the organization started as a way to help parents navigate just mental health systems. So the former executive director, her name is Deborah Sackhog. She literally started in her basement. She was just trying to help people just get the resources they needed. And back in 89, 1990, there wasn't a lot. We didn't know what we know today about ADHD or autism or any of that. So she was really kind of at the forefront of helping families figure out what's going on with their children. And over the years, that just led to working more with the professionals because those folks need to know too in order to support kids as best as possible. And what I've done is I've taken some of that foundation that she's already laid out and just amplified it and said, hey, not only are we going to work with the professionals, we also have to have community partners. The pandemic has done something that I don't think the mental health world was ready for, which really pushed us probably about 5 or 6 years ahead of time because everyone responded to the pandemic and said, I need to talk to somebody about what's going on with me. Like, I'm not okay. I need to focus on my well being.
Yeah.
And that was important. And I think in the mental health world, I'm a former mental health therapist myself. We've been wanting folks to come to therapy for a long time. Because for the longest time we've been battling this stigma thing. We always hear about stigma, 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 and now the stigma has come down and the demand has increased. But guess what? The supply wasn't there. We weren't ready for all the folks that were coming to get services. We don't have enough beds for crises. We don't have enough counselors and therapists. There's wait lists all over the country. We don't have enough cultural providers or folks who speak more than one language. But only thing we have enough of is medications, and we know that that ain't the answer for
That's
everybody.
no.
We got enough meds, but not enough
Yeah,
beds. So
yeah.
we got a lot of work to do in this space. And my goal has been responding to that on how do we help folks take care of their mental well being. That's even if they want to talk to professionals, sometimes it might not be necessary. Or how do they kind of curve what's happening until they can get in front of that professional to deal with some of the day to day, which means that we got to take a revolutionary step in the space of in mental health in the state of Minnesota that we haven't taken before.
Now, how do you, so I don't even know where you begin,
Yeah.
to be honest, because I know
Yeah.
we're talking about children,
Yep.
but how do we take, for some of the trauma these children are dealing with? We know that a lot of it, if we're talking about childhood, came from what? The parent.
Parents. Yep.
So how do we then help the child and keep the parent and not help the parent and how do you do that? Because
Yeah.
it's hard to fix the small problem when the
Yep.
big problem still exists.
I want to answer this one
Okay.
before you do,
Okay.
because I'm, like I said, I'm a fan. I'm sitting over here as a fangirl of my organization, because I don't have that same background that he has. I don't have that psychological, clinician brain. So I had to learn on my own because it's really important for the work that I do to understand the product. When you're in marketing and public relations and all that, you understand it's about the product. And so I had to learn about that product. So we actually have this amazing publication called The Guide to Infant and Early Childhood Mental Health. And it really deals with your child from infancy through 6. And what I like about that program or that division is that it brings everyone together. So it's not just the child. You have to have the caregiver in because, of course, this child can't read the book. They don't even know what they're supposed to be doing at this point. But once we bring the parents in and teach them what it is they should be expecting from their child, how they can relate to their child, how attachment is important, how everything is important, even this, for some reason we're on this little kick now where just let your kid cry because they need to get stronger. No. No, when your child is crying, that means they need you. And so don't just let your child cry. But these are the things that adults need to learn because we didn't know. Listen, my kids weren't allowed to have an attitude when they were younger. You didn't have to pay any bills. All you had to do was go to school and get good grades. You didn't have to have a job, so you couldn't have an attitude in my house. And so I understand that I probably did not do that correctly with my children. So that's why I appreciate this platform now, because there are probably a lot of adults who are like that. But it's not too late because we all still know children.
Yeah.
have grandchildren, it's not too late. So the great thing about getting them early is that you get that parent, you get that caregiver to come along with them. And even in them just teaching their children about how to navigate their mental health, there's something's clicking in their head, like, oh man, I remember I didn't have that. Or, oh, maybe if I do this, this can help me. So that's what I love about dealing with children. It just especially younger children, it automatically brings those caregivers into the picture, and hopefully it excites them to want to get better mentally for their children.
Nice. And certainly you're right, Twanna, because I know if you're teaching somebody something, you do sometimes see yourself in it, especially
Oh,
kids,
absolutely.
especially your kids, because you're like, do this, that, and the other. I told you, and then you're like, did I tell them?
Yeah.
Or maybe I didn't tell them the right way, or it just makes you start to reevaluate yourself at
Right.
on occasion. So that's great that they're getting that, but you're also seeing that. We never left, so. Um, okay, so Brandon,
Yeah.
tell me, what are your direct services? I know that some people might think you guys offer mental health directly to kids and parents, but you actually are more of a connector.
Right.
So tell me some of your direct services that you do offer.
Right. Yeah. I think our title can be a little misleading because a lot of people think that we do clinical mental health services. We are a mental health education organization, which means that we help one make sure that the professionals who do the work, mental health work, therapeutic work, have all the up to date knowledge, skills, tools, all tips and things that they need to continue to do good work. And then we also work directly with parents and caregivers to help them navigate as well. So the direct services that we currently have is we have a parent coaching program, and what that is just again helping parents navigate the systems that they're in. One of the main features of that program is helping parents who have students who are on IEPs, which are individual education plans. So if you have a young person, let's say that they may have ADHD, they may have ADHD and they may have a individual education plan. Let's say they're in the fifth grade, and this may be the first time they've been diagnosed, and this may be the first time you've ever seen an IEP with your kid. A lot of those parents call us and say, "Hey, I don't know what I'm looking at. This sheet of paper that the school gave me. They're recommending medications. They're saying they want to do X, Y, and Z with my kid. Help me." So what we do is we go help navigate, help them understand what they're looking at, help them understand what the suggestions or requirements are for their child, and then we even talk and connect them to the school. Because one thing that ends up happening for a lot of parents is they get really nervous. They have a lot of shame when one of their children goes through any type of dynamic where the school's saying, "Hey, your kid needs to fix, or your kid needs to work on, or your kid needs help with." And then the parents or the caregivers have anxiety because they're like, "I failed my kid." So we try to lessen that anxiety and let people know, no, your kid just needs a little bit of extra assistance, and here's how we can make sure that that happens for your kid. So that's one of our big services I would say is working with those parents and caregivers. When it comes to youth, we also have direct service program, and our core program right now is called Be a Leader. We are in several community organizations right now, and what that is pretty much a social, emotional learning for adolescents and helping them develop their life skills, helping them develop their confidence, helping them develop their self esteem, and some of their social ability, so that they can navigate this world that's around them because once they graduate high school, there ain't a lot out here for them to help them develop those skills. So we're trying to get with them earlier and give them some of those skills before they launch into adulthood.
And while you still have a little bit of authority over them.
Absolutely, some influence, not even authority,
Yeah,
influence. Yeah,
that's a good word because once they get to a certain point,
yeah.
they're not trying to
Because
hear.
this generation, they are the authority, and
Right.
we don't like that. We don't. I'm a geriatric millennial, so I understand where they're coming from, but it's different. These kids, they are the authority. You have to build, like I said earlier, you have to build clout with these kids. That's what the main thing is, and you have to build that clout by showing that you respect them first. That's very different than how we probably grew up, where you didn't have to respect the kid. The kid had to respect the adults.
Right,
That
yeah.
we done flip flop,
And
and we are in a whole different dimension. So reaching these young people and helping them develop their skill sets is a different art and science than what it used to be.
well, how would a parent? So if the school is talking to them,
Hmm.
Brandon, the school calls me and they're like, Tracy, your kid's acting up, and they need this services and they need that services, and I haven't. Is it at a point when you get the call when I would call you, rather I should say,
Hmm.
to realize how to even get my child evaluated to know that they need help.
Yeah,
Because
absolutely.
sometimes they might just be, they may need help in a different way, like,
Right.
you know, maybe a little bit more structure at home. It could be
Hmm.
something a little different, but really needing help. How then would I know to reach out to your services to
Yep.
get help to from that the schools are, maybe they misdiagnosed my child.
Yep.
So help me
Great
understand
question.
that.
Yeah, parents come to us at all different stages of something's been identified with my kid. What should I do? It could be at the very beginning, like, hey, I just got this information from the school. They're saying I need XYZ assessment. What should I do? But most of the parents that come to us, they wait too long. I'm being very honest about that. It's been they've bumped their head against the wall so many times. They're frustrated with the school. They're frustrated with the services that they may be getting at another organization, and now they're reaching out to kind of figure out some relief to what's happening. And we're okay with that. We'll come in and try to help you figure out, navigate as much as possible. But it would be better if folks said, "Hey, I just got this information. I need help navigating this. Can y'all help me?" But we're willing to help folks wherever they are, kind of on their journey with their child or children when it comes to mental health.
So what's the wait time? So I call you,
Yep.
and because that's what I'm finding a lot of today.
Mm-hmm.
Ooh, now when you mentioned COVID, that's a
Yep.
whole nother thing because things kind of piled up on everybody with COVID. So now we are working with things differently. Everybody's more Zoom and more this, that, and the other.
Mm-hmm.
So actually getting into services, if you're saying most of your staff works from home, it's like now you
Mm-hmm.
got to hope they answer the darn phone from home. That's a
Yep.
whole
Yeah.
nother.
Yeah.
That's a whole
Oh,
nother keeping it
oh,
real,
another
Tracy.
podcast. Yeah.
Oh yeah,
Yeah.
we gonna have that conversation too. Trust and
Absolutely.
believe. I don't think there's any topic that I'm gonna let go away. I'm gonna be on them. But how do we make sure that? I mean, what's the turnaround time? If I call,
Yeah.
my kids are acting up.
Yeah.
I don't want them to get arrested. I don't want because you know they got police in schools now, right?
Mm-hmm.
Which sometimes it could be helpful, I'm sure.
Mm-hmm.
But how soon can I expect to hear back from you?
Yeah, yeah. So for the most part, we try to have a 72-hour policy. Once we get contact, we at least reach out to let you know we got your information. Can we set up a call? So within 72 hours, we try to reach out. Does that mean that you're going to get your problem solved? Not necessarily. That means that that's what kicks off us assessing how we can be helpful. There are some cases where the dynamic is at a point where we might not be the appropriate organization to serve you, and then we're trying to pretty much refer you to one of our community partners based on what's happening. For example, we don't have the services or the resources at the moment to deal with families who are having a child with autism. So what we'll do is say, hey, we have some friends over at Pacer, which is another organization that does that very well. Let's make a referral for you over there and see if they can help you navigate your situation a little bit better.
Okay, so your partnership, because one of the other things too, Brandon, that I want to know is, are your partnerships vetted? Because don't just send me the Pacer
Yeah.
because you happen to know that they deal
Yeah, yeah.
with autism, and all I've heard is bad things about Pacer. Now that's not the case. That's not the case, listeners and viewers. I'm not saying that. I'm just saying
Sure, yeah,
if
the
that were the
dynamic happened.
case.
Yeah,
I just want to make sure that you're sending me to places that you have a real
sure.
partnership with that are really going to help,
Yeah.
especially back to our people of color.
Yep.
We want to make sure that when we walk in that door, they're looking at us like they want to help us and not looking at us like, why are we there?
Right, absolutely. Yeah, and we have and we have to keep in mind too that it's very important that word of mouth representation is very critical in communities of color. So me understanding that, me, developing the organization that we have, we try to make sure that when we send somebody anywhere, we have a direct relationship with those folks, whether that's somebody from our team that knows somebody from their team, so I can call, Emily directly and say, "Hey, Emily, I have this family. Can you help me?" That's how we help build that relationship and strengthen that relationship with the people that we're serving, and also making sure that our partnerships are intact. So for the most part, yes, they're vetted. There are some organizations that we connect with that are big organizations. So I can't guarantee that 100% they're always going to get what they need, but what we do is still try to navigate them into the right place. So without naming any organization, there are some bigger organizations that we work with that if somebody needs an assessment, I can't guarantee that the doctor that I know is the doctor that's going to do that assessment. So that experience might not be the way that I expect it to be because they may get rerouted to somebody that I don't know.
And can they come back to you?
Oh yeah,
And
absolutely.
then you'll
Yeah.
send them somewhere else.
Yeah.
So that's
Yep, for the
good
most
because
part.
at least they know if they can come back to
Right.
you then you can hear the experience they had, and
Right.
maybe at that point these big organizations might need uh, another
Yeah,
conversation
yeah,
on Tracy's keeping it real
yeah,
with some of the people that can speak
yeah.
openly about them, and we can try to help them to
Mhm.
straighten up and fly right. So I think a lot of times things are kept quiet so they go undealt with.
Sure.
So that's one of the things with the paper itself. We're trying to utilize not just this conversation today, but how we utilize that same conversation to
Hmm.
empower our community through the Minnesota Spokesman-Recorder.
Hmm.
So if we have someone that is really needing help, and they've tried some of these organizations themselves, and they've been unsuccessful.
Hmm.
People aren't answering their phones. Like I said earlier, people are working from home, so they're not being as accessible. It's a crisis we're dealing with. We're talking about mental health. Mental health
Yes.
is a crisis.
Yes.
So how do we get immediate help? How do we make sure that they don't call and leave a message and leave another message? Do they just call Brandon back? Do they call Twanna and say, "I've seen you out in the community"? What
Hmm.
would somebody do if they? Because I know when it comes to mental health, getting somebody to acknowledge that they need help is a big thing all in itself.
Hmm.
Even if especially if it's their kids, because again, like you mentioned earlier on,
Yep.
people feel like they failed their children, so they
Yep.
don't even half the time want to even talk about it. But you get them away from that. They're trying to get help. They need help immediately. They've tried other resources. Nothing's happening. They come back to you. Is there? Do you take them by the hand? Do you help them fill out the paperwork? What can
Yeah.
they do to? What can you do to help them beyond what your services
Yeah,
are?
yeah. Typically, we do take people by the hand. We go meet with them. We try to do it in a public place if we can. Sometimes we'll do home visits. We don't get too many people that come to our office to do things, but we'll do some hand holding. Um, the scenario that you put together too, it's important to understand that sometimes folks are in crisis, and we don't offer crisis services.
Right.
So what we're referring at that point is for them to either call 988, excuse me, 988 or 211 or something where they can get that immediate help. The Cope line, which is not in every county, but is another great resource for folks if they are in that crisis situation where they can get an immediate response to address the situation that's at hand. But for the most part, we're dealing with mental health issues that are not on crisis level. And one thing I want to say about the crisis piece too that's important, especially for communities, for us, for Black folks, is we utilize the emergency room too much for mental health.
We do.
Those folks are not equipped for mental health crises. But who is equipped with it? There are some is 988. That's one of the key things. But the cope line out, and I really want people to be able to understand that that is a resource that is there, that is taxpayers are funding that to utilize that when you do have mental health crisis. Because what ends up happening when you go to the emergency room is you get put into the triage. So if somebody comes in there who's bleeding, your mental health crisis is on pause.
Right.
If somebody comes in
Yeah.
there and it's a life threatening situation, your mental health crisis is on pause, and that's not necessarily what you want or what you need.
And they'll get up and walk out after a fashion if they got a mental health issue.
And that's not good either, because now you have somebody wandering who really needs some help.
Mhm.
Now they may be in the street. Next thing you know, here comes the authorities, law enforcement, and now this person's having the mental health issues they're trying to control. Now it's a ticking time bomb waiting to happen, and we want to avoid those situations as much as we can. And let's also be honest. The Twin Cities is trying to do better responses to mental health crises. It's not perfect, and it won't be for a long time because there's so much just nuance to these dynamics. But we have to do something. So yeah, and I can talk a little bit more about the responsibility that I feel like my organization and folks like us have when it comes to the general well-being of just people in general, and how we should be responding and also collaborating to make sure that the emotional health of communities is in a better place.
Well, and I know you used to yourself be one of the counselors
Yep.
that dealt with people that had mental
I
health
I was
issues, and you're no longer doing patient to patient
right.
conversations.
Right.
So what got you
What
out of that? And
happened?
yeah, did they drive you crazy? No.
Kinda. That's what happened. Yeah. So being a black male therapist is like being a unicorn. Like we barely exist. You know,
Mhm.
people find us, they hold on tight, they don't let go. And I was a young therapist. I had my cape on way too tight. I was trying to save the community through therapy, and I was going hard every day. I mean, literally from 8:30 to 8 seeing clients. That's not healthy.
No.
But I was young. I thought I could do it. I didn't have the best supervision, I'll be honest about that. Great people, but not understanding the cultural dynamics, what I was dealing with. One thing also that's true about I think black mental health professionals is a lot of times we get the clients that other folks could not quote unquote, deal with, right? So we end up having a lot of very hard people on our caseloads. And we have this cultural connection where we want to serve them no matter what without always taking the best care of ourselves. That's what happened to me. I burnt out. And I knew I was burning out, but I stayed in it as long as I could. So my first step was instead of doing full time therapy, let me do part time. So I started just to weed myself out. Because really, I started my therapy journey in 2012. By 2016, I knew I was burnt. I was burnt out. It's like all it took was 4 years.
Well, that's a lot.
Yeah.
Running them hours
Yeah.
you just said.
Yeah. And I'm gonna also be honest because we keeping it real with Tracey.
Yes, we are.
The mental health business is something that is not taught in school. and I talk about this a lot publicly. A lot of folks who want to get into this want to just help people. Excuse me. But there's a business here at the same time. And that business is not conducive to the well being of the folks who do the work. Also, a lot of folks who do this work have issues themselves. And that's one of that's one of the reasons that draws us to this work because we've been hurt, we've gone through trauma, we see that pain in other people, and we may have alleviated that pain a little bit or dealt with it, and we feel compelled to help others do that as well. That's noble. There's nothing wrong with that. But at the same time, if you have a significant portion of those types of people doing this work, you're going to crash at some point. And I think we've seen that during the pandemic as well. And as black folks get into this field, it's not easy because there's cultural elements here too that don't get addressed. When you have for example, I remember I was at one of my issues with my supervisor. I was at Henry High School and I had this young man. He was a sophomore, and he was angry little dude, man. But one of the things that I remember asking him, "What calms you down? Like you get so mad, what calms you down?" He said, "Listening to music." And I'm like, "Okay, what kind of music you listen to?" Now, he was listening at that time. It was like Chief Keef. It's drill music, the Chicago drill music, right? Shoot 'em up, bang, bang.
No, that was
Okay.
really helping.
Yeah, yeah. But that's the response.
Yeah.
But that was helping him because in his fantasy wise, he could do all the stuff he wanted to do in real life, but he wasn't doing that stuff. So I was like, okay, how can I help this kid get from one period to the next, go to class without starting a fight with somebody, cussing somebody out, yelling at a teacher? He needed to just regulate himself by listening to some music. Now, we think classical music or jazz, that all calms us down. For this kid, it was drill music. But how do I explain that to my supervisor? Because when I tell her the type of music he's listening to, she's going to have the same response you just did.
Yeah.
But for him getting lost in the Chief Keef fantasy world was all he needed to just regulate some of his thoughts to get to that next class period so that he could actually be calm enough and pay attention and learn. Now, he's still in that classroom environment that he has to survive in, so that ain't for every kid, but at least for him, he's coming in with the ability to learn. Now, explaining that to my supervisor, she thinks Brandon's crazy and I'm not using the psychoanalytic method or whatever discipline that I learned, but I am at the same time, but I put a cultural spin on it. That became challenging for me because I knew how to code switch enough to write it in my notes on what I was doing therapeutically, but explaining to my supervisor, she didn't understand nothing that I was doing, but I was helping kids at the end of the day, so it shouldn't have mattered. And I knew that if I continued in this field and I had to defend my culture and I have to explain to people why I'm doing the methods that I'm doing and they're working, this ain't a place for me to be in. And that's when I got burnt out enough to say I needed to be on a higher level so that we don't run into this issue. And no matter what cultural element we come from, we can still serve our communities and make a difference. And we don't have to explain it to anybody else how or why we're doing it if it's working.
Wow. I'll tell you, I commend you for stepping out of that and not allowing it to drive you totally insane.
Right.
Where you would no longer be of use and help for anybody, and then they wouldn't have called you to the Minnesota Association for Children's Mental Health because you wouldn't have been able to help them either.
Right.
So you're at a point now where you're actually probably doing much more better service where you're able to keep your thoughts, your mind, but you're bringing out an organization that needed to be in the community,
Right.
that needed to come from up underneath where it was to be out here broader so people know that you exist to help them.
Right.
Because one of the bigger things that I really like about what I'm hearing today is the connection where you're helping people to connect the
Right.
resources that they
Yep.
need. Because sometimes it's that 911 is the connector, but
That shouldn't be. That should never be your first recourse for a mental health crisis. You should
absolutely
not have to call
no,
911.
no.
Yeah.
But now the last thing before we end this
Mhm.
conversation, because we need to sit here for the next I don't know how long and talk about this, because we know mental health is real
Mhm.
and our children are dealing with it in real time. I mean, I talked to my daughter the other day, not for mental health, but I think about other kids. My grandson, he missed 2 years
Mhm.
because of COVID. So the 2 years that were critical for
Yep.
his age, from going from being, he was a little guy,
Yeah.
he's 9 now, but he would have been, let's just say back then, what, 3-4 years
6,
ago.
7. Yeah.
Yeah, he was 6-7.
First grade.
So he missed the 6th grade to that period that he went from being a baby
Right.
to being a young guy.
Yep. Yep.
He missed that transition in the world because he was in the house
Right.
from the pandemic, right? So you look at these kids today that are struggling with all that kind of thing, that didn't have like the parent, like my grandkids fortunate enough to have a father and a mother in their home.
Mhm.
They also have their gaga, who they call me their
Yep.
gaga. So they are well-rounded and well-loved, but we have a lot of kids that aren't, and we need
Right.
to make sure that they're getting the adequate amount of help they need right away.
Right.
So how can we make sure, though, that they know not to? I mean, what number do they call? What do they do? How do they get a hold of you
Mhm.
versus going to the emergency room? How
Sure.
do we? Because that sitting in that emergency room, if they can avoid that and really get what they need right away, that's a better course. But if you don't know it,
Right.
you won't take it.
Right. So not a number. I gave the number of 988 for the crises.
Okay.
But if you go to our website, that's probably a good place for folks to start. We have a ton of information, a ton of different links to connect you. You can get a lot of your questions answered on our site, and our site is www.macmh.org. Anything else you want to say there? Because you're a resource person. Like, I feel like I've been dominating the conversation. Anything you want to add there?
Twanna, too, make sure to repeat that website, because
Yeah.
I'm looking for a pen and I'm trying to write
Yeah.
it down. That's what
Yeah.
I'd be doing at home right now. So
Yes, that's our acronym, and MACMH, MACMA. If it doesn't seem like that's the way you should pronounce it, but
Yeah.
we call it MACMA. So it's just macma.org.
okay,
Very simple.
great. And what do you want to add? Like Brandon said.
Oh gosh. Let me think. There's just so much. If I can just interject, because I think one of the things, and I know we're probably coming up on time, but one of the brilliant things that Brandon thinks about is how do we connect mental health to public health.
Mhm.
And I would really love for you to just talk about that for a minute, because I
Okay.
think that that's going to be the difference within the community as soon as we start thinking about mental health as being just a part of health and not separate from our everyday upkeep. I think we're going to go a long way with that. And if we can get it started earlier in their lives, the better. But I love his take on that. So I want, I would
Sure.
like to just,
That's a
So-
wonderful way to close.
Yeah,
'Cause that is very.
I can close out. So this is my big idea. When I look at myself and how I want to make an impact in the state of Minnesota of mental health, if I can get this off the ground, I think the impact can be made. Earlier, Tracy, you mentioned, where do I start? Like, you got this, and that. Like, I don't even know where to start with this mental health thing. And there's a reason for that. The reason for that is we are at what's called a wicked problem. And a wicked problem is something that's so complex and compound, you don't know where to start because there's no cookie cutter solution. And there isn't. But there is strategies that we can take to deal with this challenging issue. Twanna believes heavily in early childhood. That's one angle. Some people like, no, we gotta deal with these parents because they ain't gonna be able to take care of these babies if they ain't okay.
Yeah.
That's another angle. Some people are like, these institutions, they don't care about. Nope, that's another. Like, well, all those angles have to be addressed. So when I think about it, and I think about, okay, how have we tackled big problems in the past? What happened? I look at the mental health problem today and I compare it to the tobacco issue that we had in the 90s. Now, if people remember, smoking was something that was normal. I mean, if podcasts were happening in 1993, we'll be all smoking cigarettes having this conversation right now,
Yeah.
because that's how common it was.
Uh-huh.
Hotels, airplanes, common spaces at work, people just smoke cigarettes. That's what it was. But what we neglected was the harmfulness of nicotine. And at first, it started and kicked off with big tobacco. Legislators started going after big tobacco. They were going to get that big tobacco money. And then after the legislators kind of start getting things moving on a state level and a national level, that's when you seen public health come in. And public health did something that was revolutionary that affected all of us. They put on screen something that touched all our hearts, and we probably haven't seen something that emotionally driven ever. Do you remember the commercial where the lady had throat cancer with the hole in her neck, and she was using the microphone? Everybody remembers that.
Yeah.
That was the turn. That was the turn from the public psyche that smoking is bad, because people seen their mom, they seen their sister, they seen their grandma, they seen little old Karen who lives next door. She has throat cancer from smoking. And everybody said, "Oh, heck no, we ain't doing that. But we got to do something." And then you started to see society respond to smoking. At first, they started to regulate smoking inside of places. And then a few years later, they started to set that 15 feet marker outside of. Do you remember when they were doing the chalking outside of doors and stuff? And then after that wasn't good enough because people didn't want to walk through all that smoke, they said, "Okay, go smoke across the street." But then the business across the street said, "No, don't bring all that smoke over here." So now,
outside.
yeah. So now where people smoking at? They smoking behind a dumpster. They got the little Pepsi or Mountain Dew, and they just back there smoking their cigarettes. Because that's how public health has influenced the mindset around smoking, that we don't want it around us at all. Can you imagine being on an airplane today and somebody lights a cigarette? What do you think will happen? It's gonna be a fight.
Yeah. Oh
just
yeah.
just from a cigarette.
On Facebook. For
Yeah.
sure.
Just from that, but that's how far we've come from looking at something that was so addictive, so hard to shake, to today people are ready to throw blows if somebody lights a cigarette. If somebody came here with a cigarette, you gonna let them out. Goodbye.
Yeah. Be like, "Oh, show's over."
Yeah. Gotta go.
Yeah.
Because that's what changed. So I say, dang, if we can do that with something that addictive, we can do that with mental health. If we really care about our babies, we can do that same thing. We can approach mental health and emotional health from a public health angle, use their tools, use the knowledge base of all these therapists and these wise people, and we can make this shift happen in the mental health space. It is a crisis. You mentioned that. The Attorney General has mentioned that as well for the United States. And if it really is a crisis, let's do the work that we need to do to make sure that everybody has a well-being approach. We need to be able to teach society how to just take general care of ourselves, because for so long we haven't taught it at all, and we're seeing the ramifications of that right now with our children. The chaos that we're seeing in our community, it's all our kids. Nobody wants to be honest about it.
No.
But next time you see a 9-year-old with a switch on a Glock and an extendo clip, remember, that's because that baby wasn't taken care of properly. Don't just blame their parents, blame the community, because we all have work to do.
We all have that old saying, "It takes a village," is a real saying, and it really is something that we all need to be able to do, is take a village. And I know, Brandon, that you are not going to be able to solve all our mental health crises, but if wherever you need assistance in trying to help to get the word out, or help to galvanize the community, or whoever needs to hear that message that you just said, because you're going to need to get that. It has to get out.
Yes.
We have to get that message out. Count on MSR to be that.
Appreciate that.
Really
Absolutely.
Get that message out, because it's important for
Absolutely.
Our community. So I really enjoyed this time. It's not enough. We're talking about a very serious topic. Mental health it's with our children, it's with our adults,
Right.
It's with our community, it's with the people, like you said, that are helping our community. It's with everybody, and it just depends on at what level, but we all need that help. So we're very grateful to have you step up the helm on what you were doing, and get to that level. And I'm glad they had the foresight to bring you on.
Absolutely, thank you.
Because you really understand what you're doing, and it sounds like you're getting this organization down the right path.
Thank you.
Twanna, I know you talked about your film industry was the thing. Your film experience was something. We're gonna have to call you on that. and get you involved in some other things with the film behind. We ain't taking them away from you,
No, no.
Brandon.
Hey.
We need some women that can do film as well. But certainly we want to make sure that you continue to grow in the community wherever we can help you with that as well. So thank you so much, and thank you listeners and watchers, for viewers, for kind of tuning in to Tracey's Keeping It Real and kind of seeing where we're at and what we're talking about this afternoon. Very important topics that we're dealing with here. And we look forward to seeing you back next time. Until then, thank you. And remember, Tracey's Keeping It Real.